Hi, on behalf of Team 5, today I will be discussing the Berg Balance Scale. The Berg Balance Scale is a 14-item scale designed to measure the balance of an older adult in a clinical setting. Patient populations that may perform the Berg Balance Scale include the geriatric population, individuals with impaired balance, patients with stroke or other neurological impairments, and patients with dementia. To perform the Berg Balance Scale, equipment needed includes a yardstick, two standard chairs, one with armrests and one without armrests, a footstool or a step, a stopwatch or a wristwatch, and a 15-foot walkway. The Berg Balance Scale consists of 14 tasks the individual will perform. The performance of each task is rated on a scale ranging from 0 to 4, where 0 indicates the lowest level of function and 4 indicates the highest level of function. The specifics of this scoring system will be described in further detail with each task throughout the presentation. The total possible score for the Berg Balance Scale is 56. An individual scoring between 41 and 56 is considered independent. An individual scoring between 21 and 40 may walk with assistance. An individual scoring between 0 and 20 may be wheelchair bound. An individual scoring less than 45 may be at risk for falls. The scale is measured depending on the tasks, with units consisting of yards, feet, or seconds. The first task is a sit-to-stand task. The individual will be measured by their performance and their ability to stand safely and independently. Next, the individual will stand unsupported. They will be measured by their performance in seconds to minutes and their ability to stand safely for a maximum of 2 minutes. Next, the individual will sit unsupported with their feet on the floor. They will be measured by their performance in seconds or minutes and their ability to sit safely and independently for a maximum of 2 minutes. The individual will then perform a stand-to-sit task. They will be measured by their performance and their ability to sit safely with little use of their hands. The individual will then perform a transfer task in which they perform a chair pivot transfer. They will be measured by their performance and their ability to safely transfer from one chair to the next with little use of their hands. The individual will then stand unsupported with their eyes closed. They will be measured by their performance in seconds and their ability to stand safely for a maximum of 10 seconds. Next, the individual will stand unsupported with their feet together. They will be measured by their performance in seconds or minutes and their ability to stand safely and independently for a maximum of 1 minute. The individual will then perform a task in which they reach forward with outstretched arms while standing. They will be measured by how far they reach forward in centimeters or inches. The individual will then perform a task in which they pick up an object from the floor from a standing position. They will be measured by their performance and their ability to safely and easily pick up the object. The individual will then perform a task in which they turn to look behind both their left and right shoulders while standing. They will be measured by their performance and their ability to look behind both shoulders easily and efficiently. The individual will then perform a task in which they turn 360 degrees. They will be measured by their performance and their ability to make this 360-degree turn safely and in 4 seconds or less. The individual will then perform a task in which they place alternating feet on a step or stool while standing unsupported. They will step each foot onto the step or stool 4 times for a total of 8 steps. They will be measured by their performance and their ability to complete these 8 steps independently and safely in 20 seconds or less. The next task, the individual will stand unsupported with one foot in front of the other. They will be measured by their performance in seconds and their ability to stand safely and independently in this position and hold it for at least 30 seconds. In the final task of the Berg balance scale, the individual will stand on one leg. They will be measured by their performance and their ability to independently and safely stand on one leg for at least 10 seconds. It is important when administering the Berg balance scale to take into account certain safety considerations, including the safety of the surroundings in case the patient happens to fall or get dizzy, to assess the static and dynamic balance before leaving the patient unattended, and to always provide close supervision to the patients performing the Berg balance scale. Looking now at the reliability, validity, and responsiveness of the Berg balance scale, on the left, we have a randomized control trial that calculated the minimal detectable change for older adults undergoing physical therapy in a rehabilitation setting to determine the amount of change needed on the Berg balance scale. The authors suggest that as an individual's assistance needs increase, the amount of change on the Berg balance scale must also increase for it to be a clinical change. Additionally, as an individual's performance decreases on the Berg balance scale, a higher minimal detectable change is needed. Looking at the right, we have a systematic review, which found varying sensitivity and specificity values across the included studies regarding the ability of the Berg balance scale to determine risk of falls. The authors suggest the Berg balance scale be studied in multiple diagnostic groups to determine the best cutoff score on the Berg balance scale for falls risk, as this may vary across diagnostic groups. Overall, we find that the Berg balance scale is effective in that it includes many tasks to be performed related to balance. However, one of the biggest limitations for the Berg balance scale is its ceiling effect for patients that may not have severely impaired balance, but are still affected by balance-related deficits. The information presented in this study came from the Pepper Center and the Geriatric Toolkit. Additionally, the instructions and the scoring system used for each task is from the Geriatric Toolkit. Thank you so much for watching.